Belum dibuka untuk share screen-nya.
Oh, Arifin mungkin bisa di ini settingannya. Kayaknya belum di ini ya. So Leah will present in English, but for the discussion, yeah, you can mix. Yeah. Okay.
Okay.
Congratulations also your new role. You're starting tomorrow at the Ministry of Finance.
Yeah, I'm going to Jakarta now. I'm at the airport now.
Wow, exciting.
Yeah. Okay. The headline of my presentation today is the state of the art of dashboard in the context of climate change and health, as mentioned by Connie previously. Several studies have revealed that climate change affect various sectors such as agriculture, marine, forestry, and others. If left undetermined, climate change will affect the health profile of current and future generation. And this will be a burden on an already overwhelmed health system and hamper the SDGs and UHCC programs. And then the health sector is doubly burdened by direct impacts on health and indirect impacts that are strongly influenced by determinant of the social environment and public health. This slide provides a flow chart of the triggers of disease incidents due to climate change and the impact of the phenomenon on the health sector. There are multiple connections between climate and health. The first one is the direct impacts on human health, such as those which arise from damage and illness from increased frequency and severity of extreme weather events. And then impact mediated through other environmental system, this including rising air population, air pollution, and changing patterns of factors, and then food and waterborne disease. And the last one, socially mediated effect, which occur via climate change, interaction with social and human system. This include health effect resulting from undernutrition and then occupational heat stress and mental illness, as well as potential increase in population displacement and risk of violent conflict and slowing of economic growth and poverty reduction. Yeah, this figure provides a brief overview of climate sensitive health risks, including exposure pathway and vulnerability factors. These health impacts of climate change are strongly mediated by environmental, social, and public health determinants. From this point, we can further break down the health risks and vulnerability factor into indicators that will be used to build the dashboard. And then climate change also brings an increased risk of health impact, with some disease predicted to increase. The disease identified in this figure are closely related to the phenomenon on climate change. Example, for Aceh province, diarrhea is a high case of disease with increased precipitation, climate variables. And then in Maluku province with malaria disease case, climate variable precipitation and temperature are also increasing. Bloom's theory state that health status is determined by 40% environmental factors, and then 30% behavioral factors, and then 20% health service factor, and 10% genetic factors. Each case of disease has determining factors that are not the same as other disease. Identification of factor for that determining the incidence of a disease is conducted to determine the availability of existing data. And in general, data related to health can be collected from various surveys, and then study or recording, and also reporting of programs and sectors at the national and district level, such as Riskesdas or Riset Kesehatan Dasar, and then Susenas, survey status ekonomi nasional, Rivaskes is riset fasilitas kesehatan, and then from other institution like BMKG, BNPB, LHK, BIK, and also BPS. Okay, next, this is the mapping of indicators and their data source. Okay. Ya, sudah kelihatan ya yang ini, yang Excel-nya?
Kelihatan.
Oke. Ya, mungkin untuk yang ini saya izin pakai bahasa Indonesia ya, biar lebih ini. Jadi dari faktor-faktor pembentuk seperti penyakit tadi itu banyak gitu yang bisa kita lihat sumber penyebabnya gitu ya. Misalnya seperti kesehatan lingkungannya seperti apa, kemudian fasilitas di sekitar lokasi tersebut seperti apa. Nah, ini hal-hal yang mempengaruhi kondisi kejadian penyakit di suatu daerah gitu ya misalnya. Nah, kemudian untuk datanya sendiri, untuk memulai kita bisa membuat gambaran kira-kira data apa saja sih yang dibutuhkan. Jadi kalau dari presentasi saya sebelumnya itu kan sudah di sedikit ada gambaran gitu ya. Kita harus membuat flow chart-nya dulu gitu. Sebenarnya apa aja sih yang menyebabkan penyakit ini, kemudian faktor-faktornya apa aja. Nanti dari faktor-faktor itu baru kita turunkan menjadi indikator-indikator yang lebih rinci. Nah, mungkin ini adalah gambaran indikator-indikator yang mempengaruhi penyakit-penyakit yang berhubungan dengan perubahan iklim gitu, seperti indikator prevalensi stunting, kemudian juga topografinya dari segi biofisiknya, kemudian dari fasilitas kesehatan bisa dilihat juga akses ke fasilitas kesehatannya seperti apa. Nah, dari sini bisa kita petakan dari indikator-indikator yang sudah kita rincikan ini, lalu kita bisa mengidentifikasi lagi sumber datanya kira-kira kita bisa dapat dari mana nih gitu. Misalnya prevalensi stunting ini ada di publikasinya Kemenkes SSGI 2022. Ini tahun rilis terakhirnya itu adalah 2022. Hanya format datanya mungkin yang dirilis itu adalah PDF, sehingga kita harus membuat format itu menjadi standarisasi yang sama gitu antara satu data yang ada di indikator pertama, kedua, ketiga itu harus seragam sehingga bisa digunakan secara bersama-sama gitu. Mungkin itu sedikit gambaran terkait dengan penentuan indikator yang bisa kita gunakan untuk membangun dashboard nantinya. Silakan jika ada tanggapan dari teman-teman yang lainnya.
Sudah ada Kak pertanyaan di layar chat dari Koni beberapa.
Oh, oke.
Sorry, it's not specifically for Leah, but maybe some discussion for the floor. I'm just asking like what makes a good
Yeah,
or
yeah.
bad dashboard. It's a very broad question. I guess dashboard have been developed so many, I think, during COVID time. And I think many of us has used maybe some or several dashboards. What do you think it's making a good dashboard? And what kind of feature that you specifically like? Okta left the comments, the meeting. Anybody? Or Leah, would you like to go first? What do you think?
I think a good dashboard is when the dashboard digunakan.
The
Gunakan,
dashboard
ya.
that is in use.
Ya, mau secanggih apapun dashboard, kalau tidak digunakan, ya percuma gitu.
Yeah. So I think the first feature, it has to be used.
Yeah.
Then I think the next question will be who will be the user, right? So
Yeah.
if not specific with who is using it, then we don't know if the user is happy with the dashboard as well.
Yeah.
Sorry. Yeah, Leah, go on, sorry.
Ya, mungkin seperti yang di-mentions oleh Prof. Taufik sebelumnya ya. Kalau beliau kan menekankan pada sustainability dashboard ya. Akan tetapi kita perlu melihat juga dashboard ini cakupannya itu akan seperti apa dan digunakan oleh siapa gitu. Kalau memang hanya digunakan oleh puskesmas setempat atau puskesmas pilot yang kemarin itu dikunjungi, itu artinya kita tidak usah melebar ke mana-mana gitu, karena kita perlu bertanya ke mereka sebenarnya apa yang mereka butuhkan gitu. Akan tetapi kalau digunakan untuk level yang lebih atas, misalnya level
dinas,
provinsi atau dinas, nah maka kita bisa mengcombine itu dengan data-data dukungan lainnya gitu, seperti data dari BPS, BMKG dan lain-lain, sehingga itu bisa dimanfaatkan untuk pengambilan keputusan, walaupun memang data yang disediakan itu rilisnya itu berbeda-beda gitu. Misalnya Riskesdas itu kan sekitar 4 tahun sekali apa 2 tahun sekali gitu. Kemudian SSGI ada yang tiap tahun gitu. Nah, saya rasa itu tidak masalah karena keputusan yang dibuat oleh level yang di atas itu kan sifatnya juga bukan jangka pendek gitu. Jadi bukan untuk monitoring, tapi lebih ke membuat kebijakan atau mengambil keputusan gitu.
Okay, so I just do a quick translation for our colleagues in Australia. Leah was saying the point on sustainability. So the usability, who is the user, and the sustainability. So if we are only targeting the 3 puskesmas that we chose for this project, it wasn't really worry us if that's going to be an upskill that all the puskesmas in Indonesia or the upper level provincial, the city level health officers need to use it. So if that's not our worry or our concern, it will be much more easier when we build our dashboard. But at this point, we do want this dashboard to be more long-term use by more than 3 puskesmas in Indonesia. So we need to consider if those data that we are using, is it specifically only for the 3 location, or is it possible to be upscaled to other puskesmas as well? So I think I can answer this. We do need to consider that the scalability of the dashboard. Then Leah was saying some data is coming in a very different time frame. For example, survey for SSGI will be every 4 years or every 2 years. And she was saying it's not very much a concern because sometimes those data is not for real-time monitoring, but for long-term planning for policy development. So those are more long-term trend pattern type of analysis. So it's not too much of concern if it's, you know, every 4 years or every 5 years type of not a real-time data. Leah, do you want to add anything if I miss your bahasa? Hello?
Hello, yeah. Sorry, disconnected.
It's okay.
I think it's already complete, Connie.
Okay.
Okay.
So the criteria on usability, sustainability, what else do you think makes a good dashboard? People can also put in your input. For me, I think design is important. Attractiveness, user friendliness.
Yeah.
You can't have people to click like 10
maybe
times to get the data.
Ya, mungkin akan berguna juga jika kita tambahkan sedikit narasi ya, sedikit saja tapi jangan sampai teks itu mendominasi chart atau map dalam dashboard, karena bisa bisa membantu user untuk memahami apa sih data yang ada di dalam dashboard tersebut gitu. Jadi sedikit narasi itu saya rasa juga sedikit membantu lah untuk user itu membaca apa yang ada di dalam dashboard gitu.
Okay, so I think third point Leah was saying about the visualization, not many text, but still some full text to understand what is the data mean. So it's not also, so it's very important. We don't want the data to be misinterpreted, right? So it's some visualization can lost in the middle, like people just misinterpret what that data mean. I think also linked to what Liki put in the chat, how reliable those data. So we need to have a reason for them. So that data or analysis of the data should be helpful for the user. And it's easy to understand. So it's not very packed, neat, like clear, right? So the visualization part. Anybody? I saw Daddy's in the room. Elfie, Rizka, Yanur, Zed, Dian, Cecily. Any favorite dashboard feature that you like?
I would say dashboard is one that effectively convey information and user can meet the specific needs. And visual design is crucial. The dashboard should use chart, graph, and visual to present data in visually. I think like that.
Okay, thank you. It's very important. Yeah, and Elfie was saying good dashboard involves user to gather feedback. So I think most of the dashboard right now is really one way. You don't have the discussion or feedback feature for user to give feedback. And regularly updated is also costly. So we can also need to consider how much resources that we need to put in order to maintain the dashboard is still updated and it's still relevant for our stakeholders.
Ya, mungkin Koni sedikit menambahkan ya.
Ya.
Terkait dengan climate change, ini kan sebenarnya juga hal yang tidak bisa kita lihat hanya dalam waktu pendek gitu. Benar nggak? Jadi untuk melihat perubahan iklim ini kan butuh time frame yang agak panjang gitu. Itu kenapa saya merasa bahwa data-data sekunder dari instansi seperti BMKG, BPS, BNPB dan lain-lain itu sangat bermanfaat gitu karena itu tadi ya terkait dengan perubahan iklim sendiri kan nggak bisa kita lihat dalam harian gitu ini perubahannya gitu.
I think Leah was saying because climate change is a long-term variation and it's big. We don't maybe necessarily see changes by day. How can we track? That's a yes and no question. Answer, sorry. We definitely break it down to more monitored type of data. So for example, heat or temperature, we monitor daily. Precipitation, we monitor daily. But of course, in long term, we see the pattern and changes. But we can't really see, like you say, the impact of what you do right now will be changing. So we can't say we do something today, then tomorrow dengue cases will come down, and because this good strategy. So we need to choose what kind of data would be short-term, more real-time monitoring data compared to the more long-term one. So this one, we will need the stakeholders' input. Like you were mentioning and suggesting, the BPJS, the health insurance type of costs or money, it's more real-time. So then the stakeholder can also see the differences and the results, like for more fast feedback. So you don't want to make an implementation and wait for 2 years. Okay, wait, so is it working or not? So I think we do need to choose some of the more short-term one. And Cecilia said, is it possible to have sex disaggregated data to understand the impact between genders? So a good dashboard or a gender just dashboard should be helping us to see who are the vulnerable population. So I guess not only sex, but ethnicity, religion, geographic region, income, employment, all these social determinants as well should be presented. It's not just broad. Okay, we have 100 cases of dengue, but happen where and which family? I think a good dashboard should be more flexible and more informative if there's more disaggregated data to help identify more specific and plan for more specific intervention for who. I don't know if anybody else. Oh, Oktober, you joined. We lost you for a few seconds. Sorry.
Yes,
Tony?
sorry.
Halo?
Yep, Leah.
Mungkin di sini kebetulan lagi ada Bu Dita ya dari BPS. Mungkin ada sedikit hal yang mau saya tanyakan Bu Dita terkait dengan data-data yang dimiliki oleh BPS. Kalau level provinsi atau kabupaten kota itu memiliki data yang sama dengan di pusat atau apa ya istilahnya tuh dipecah gitu. Misalnya saya hanya ingin melihat data provinsi Aceh saja gitu. Bisa nggak kalau misalnya kita meminta data itu ke levelan provinsi Aceh hanya untuk data provinsi Aceh aja atau memang harus mintanya ke nasional. Jadi nanti dari nasional itu diberikan data secara nasional kemudian kita memilih provinsi mana yang kita mau gitu.
Baik, terima kasih Bu atas kesempatan yang diberikan.
Iya.
Ya, jadi langsung saja. untuk data-data dari BPS ini bisa langsung diminta sesuai dengan level yang diinginkan. Jadi kalau data yang diperlukan tingkat provinsi bisa langsung ke provinsi, kalau dari data kabupaten bisa langsung ke kabupatennya masing-masing.
Baik, itu baik berupa data misalnya seperti data Podes, itu bisa ya mintanya ke provinsi berarti ya Bu ya?
Ya, cuma
Oke,
untuk Podes ini kan terakhir dilaksanakan 2021.
Iya,
Jadi tidak setiap tahun gitu ya.
iya benar. Baik.
Thank you. Leah was asking if the potential getting data from different level. So Ibu Ditalia was advising is actually possible to just ask and request which level that we want. So I think it's nicely aggregated from a different level. Leah, would you maybe stop sharing the screen so that we can see each other? Thank you. That was fast. I don't know other people if they have any other ideas or input. You can also share your favorite dashboard, what kind of feature that you like. So far we have the usability, sustainability, what kind of data level, real-time, non-real-time, analyze data, nice, attractive feature design. What else do you think it's makes a good dashboard?
Storytelling, I think storytelling is important, Connie. So we can, jadi bisa runut gitu bercerita asal muasalnya gitu. Yeah.
Wow, it's a huge expectation from dashboard. So when we go into your dashboard, you'll have like a storytelling
Ya,
voice.
jadi penempatan menu mulai dari mana, jadi dari situ nanti kemana gitu ya.
Yeah. That's very important. I think more and more important, how do we communicate those data, right? So it's not just people going in, we see charts, map or bar charts that what this data telling us, or what kind of next step should be should help us guide and inform us. That's important. Thanks, Leah, for the point. We need to think of how can we do that. So I think some dashboard are they combine early warning feature. So for example, they are not just analyzing those data. They tell you, okay, this means that tomorrow you will need to buy something for your home. In the next few days, it will be heavy rain. So there's a call for actions like from the dashboard. I don't know if Leah, you mean this. So those data really kind of tell you, okay, this situation is happening or will happen. And in your context for you yourself, as a farmer or people working outside, what you will need to do.
Could you include as well what's happening in other puskesmas locally? So if there's an increase in a disease in those, then you could sort of see maybe that might be coming to us, like closer.
Yeah. Okay. So not just looking at ourselves, but we can also see our peers, like how are they doing? Okay. Yeah, I guess in the COVID time, those dashboard help see other countries, what are they doing? It's like competition itself as well. Yeah. What else? Diane, what's your thoughts? Diane, ignore me.
Hello, Connie.
Yes.
Maybe the dashboard, the useful dashboard is it is important. Mungkin yang penting, yang paling pertama yang harus kita pikirkan adalah dashboard itu harus berguna dan dapat digunakan oleh tidak hanya pemerintah tapi juga masyarakat gitu, Connie.
Yeah, thank you. Yeah, I guess we haven't really sure who are our target user, right? So Dian was saying it's not just for the government itself or Puskesmas staff, but also useful for the public. Then we need to identify what would be their needs, like what would they want to see from the dashboard.
Ya, mungkin kalau terkait pengguna itu
Yep.
itu balik lagi ke tujuan dibangunnya dashboard ini untuk apa. Karena beda tujuan, beda pengguna. Tujuan untuk monitoring, maka dashboard yang akan ditampilkan pun juga berbeda. Tujuan untuk pengambil keputusan, maka dashboardnya juga akan berbeda gitu. Dan penggunanya juga secara langsung juga akan berbeda gitu.
What do you think
Nah,
is our tujuan?
tujuan misalnya kalau yang kita lakukan kemarin dengan mengunjungi puskesmas itu kita melihat lokal secara puskesmasnya, maka dashboard yang cocok gunanya adalah orang puskesmas itu adalah dashboard yang terkait dengan monitoring dan evaluasi karena datanya mungkin yang mereka punya bersifat real time, yang primer gitu dan mereka bisa mensuplai data itu secara terus-menerus. Nah, apabila dashboard ini digunakan untuk mengambil keputusan untuk level yang lebih tinggi dibandingkan puskesmas, level provinsi atau juga kabupaten kota, maka tujuan dashboard ini biasanya adalah sebagai dashboard yang digunakan untuk mengambil keputusan dan ini levelnya adalah eksekutif gitu. Ya, biasanya data yang ditampilkan di dashboardnya itu tidak detail. Kalau di puskesmas yang mereka gunakan adalah data yang lebih detail gitu.
Thank you, Leah. So Leah was saying that we need to go back to ask ourselves that what is the purpose, main goal we want to develop this dashboard? Is it just for reporting purposes, or we just want to see the outcome? So I guess we don't need another dashboard for reporting, just to make those data to put together in one screen. But what else would be helpful for the Puskesmas? From the visits that I had in the fieldwork, my observation was those data wasn't analyzed. So a lot of the complaint would be they keep report all the data to different people, but all this data wasn't analyzed and helping them to plan for the next or the future health services. So they doesn't know if the outbreak 10 cases today, is it an outbreak? Do we need to alert or exercise other type of resources? You know, what kind of thing that we need to prepare? So that's I think my observation. Maybe Okta, you can share what's your thoughts.
Yes, Connie. Leah, is it possible if we combine like the dashboard for monitoring and the dashboard for the decision making? Because like Connie said, actually this dashboard is aimed to support the puskesmas to monitor and also to support them to make right decisions for to better response to the climate change impact, especially in the health sector.
Yeah, it's very possible, but kita harus mengidentifikasi indikator-indikator yang digunakan tadi itu secara rinci. Misalnya kalau untuk monitoring dan evaluasi tentunya indikator yang digunakan akan berbeda dengan pengambil keputusan. Jadi coba sekali lagi ya yang ini. Ini misalnya contoh gitu ya. Contoh untuk mengambil keputusan kita mau melihat daerah mana sih yang paling terdampak dari climate change. Maka kita akan melihat indikatornya itu diantaranya adalah demografi, kemudian sosiopolitiknya seperti apa, sosioekonominya seperti apa, sosioekonominya seperti kayak kemiskinannya seperti apa, kemudian nah faktor-faktor ini kan yang ngebentuk tujuan dashboardnya itu dibangun untuk apa. Nah, jadi mungkin saran saya adalah artinya kita membuat dua dua peta indikator yang digunakan untuk monitoring dan yang satu lagi yang digunakan untuk apa pengambilan kebijakan atau keputusan gitu.
But it will, will display in one dashboard, or should have another dashboard to, like for example, dashboard for monitoring or dashboard for decision making.
I feel it would be helpful to combine them.
Or do you have any example, one dashboard who has the role for monitoring and for decision making?
The Green Hospital dashboard that I helped build for Taiwan Hospital was combining the both.
Oh, okay.
So the hospital itself have to report their energy use, water use, all these different emission type data, but they don't need to analyze. So when they key in, they will have results. So from the policymaker point of view, they will see, okay, the hospital with 1,000 beds every year, how many energy they're using. So it's helpful to plan, okay, still so many hospitals haven't turned or changed to solar. Then they start to maybe have a policy to encourage hospital to uptake like solar panel. So the prediction and projection is also there for analysis. But like what Leah was saying, not all or everyone has the same access level to see the dashboard data.
Yeah,
I think the flow is important, like what Leah was saying.
Yes, especially the indicator that built the dashboard itself, right? And and also the level of access. Like yes, this is to support the puskesmas, but we would like also to have the dashboard who is also can be, like Dian mentioned, benefit for the community, especially for the head of the village, for example, and they have the mini workshop every regularly, and then also for the dinas itself. But yeah, there will be like a leveling of the dashboard to access the dashboard.
So I guess what Leah was mentioning and the concern would be how decision making can be incorporated into the dashboard. So right now we haven't seen any like the list of health services that provided by the puskesmas. We have that. Then you have the vulnerability map with all the demographic, stunting, low income. Then you have the environmental data to help project outbreak or extreme weather events. Then you have the puskesmas services to see, okay, we have this vaccine program going on every 3 months, but if predicted floods happening more and more, then maybe we can't help or host those programs. So how can we change or reorient and do our health services differently? Then after 6 months, the puskesmas will see is the rate or the disease maintain or increase. So they will know, oh, this change of health services is working or not. So that's like one example. I know I sound very nerdy now.
So do you mean that I mean this dashboard not only helpful for those services that is related for the environmental or climate change, but all the services provided by the Puskesmas? Like for example, this is according to the regulation, there are at least 11 services, including the maternal and child health, and then nutrition health, environmental health, and then infectious disease, public health education, school health services, adolescent health, dental and oral health, inpatient care.
I think it's sometimes it sounds very ambitious to cover all the services. I think maybe we can pick one to start with. I guess this project is trying to see how health services to be more climate sensitive and gender and social equity. So we provide like an example. For example, if we are targeting mother and child or stunting
infectious disease, nutrition health, okay,
or nutrition health, then of course we will have some data to tell us the food security problem or the floods or the extreme weather events that have impact on food accessibility or stuff like that. Then we have the health outcome from the BPJS or the Puskesmas itself to help us see. I don't know if we want to go so far or we have more intermediate, like more short-term type of indicator to help understand the progress. Like how many women or mother come for prenatal health checkup, those kind of indicators.
Okay. So, yes, I think Connie, because today we have Bu Dita who will present next month in our knowledge sharing session. I think I also forget to invite. So I think like Bruri, why don't he join this meeting, and also some of the like Dr. Hendra. I think I missed some of our team. So I think for next month, especially because Budita will present, if do you have any suggestion like what kind of information will be needed for her to present to us? Like today we have Leah, so hopefully Budita have like a general idea about the the data will be possibly related to our research.
I hope Ibu is not too scared of that. He doesn't want to come next month.
Ya, jadi mungkin kalau ada kira-kira nih terutama dari tim data ya, Lia, Rizka, sama Alfi, kira-kira informasi apa yang dibutuhkan nanti biar Bu Dita mungkin bisa menyiapkan ya, masih ada waktu sebulan ya Bu Dita ya, menyiapkan bahan-bahan untuk bisa di-share ke kita gitu. Apa ya kira-kira dari tim data nih? Tadi sudah sempat menanyakan ke Bu Dita, Bapak, terkait dengan kemungkinan kan untuk data yang level provinsi sampai level terkecilnya itu bisa didapatkan ternyata dari BPS Aceh. Jadi kita tidak perlu meminta ke BPS nasional gitu. Oh, oke. So we can ask the data from each province, like for example, if we need the Mataram and Ambon, we can ask the BPS in West Nusa Tenggara and also in Maluku province, BPS. Yeah, and I remember Professor Taufik in our previous meeting mentioned regarding the type of data. Yeah, maybe do you still remember what? Yeah,
API.
the format. Yes,
API.
yes. Yeah. So I don't know whether
we should also consider about this format like
Yeah.
the BPS use
Yeah.
for the
And
data.
he was mentioning about data that on website that we can just scrap without requesting.
Yeah. So maybe I don't know, Leah or Rizka could explain more about this.
Jadi Bu Okta, saya mau nanya ke Bu Dita. Jadi Bu Dita kan, misalnya kami ingin mengintegrasikan data dari BPS ke website Korsted kami. Nah, itu apa kami harus mendownload datanya di website BPS atau kami bisa mengambil datanya itu secara real time pakai API gitu. Jadi nanti kami buat script kode, nanti kami sesuaikan formatnya dengan format data dari BPS atau jadi pertanyaannya apakah bisa pakai API atau kami harus download dari website BPS itu Bu Dita.
Untuk data-datanya bisa langsung download dari web. Kemudian kalau memang tidak tersedia di web bisa langsung ke BPS provinsinya. Gitu.
Itu berarti kami harus kasih surat dulu ya?
Bisa langsung juga sih, biasanya ada bagian PST, bagian di perpustakaannya.
Di provinsi ya?
Iya, iya.
Kalau format datanya dalam bentuk apa ya? Karena kalau yang di web itu kan saya biasanya aksesnya dalam bentuk PDF gitu kan? Atau ada format lain?
Oh iya, ada Excel-nya juga biasanya.
Oh Excel ya.
Iya.
Kalau secara real time gitu bisa nggak Bu Dita? Misalnya kalau Excel kan kami downloadnya tuh harus per waktu kami butuhkan gitu ya. Tapi kok secara real time bisa nggak?
Kalau ini datanya
Datanya bukan data real time soalnya
iya,
itu ya.
Iya.
Oke.
Baik.
Jadi data yang tersedia di BPS itu adalah data yang sudah dirilis resmi gitu. Itu maksudnya. Jadi kita tidak bisa meminta data yang
bukan data mentah ya.
Ya, makanya kenapa kan periodically dia biasanya ada yang datanya 4 tahunan, kemudian ada yang 2 tahunan, tergantung data apa yang kita minta gitu. Beda-beda time frame-nya gitu.
Oke, baik.
Mungkin sedikit tambahan, kalau memang perlu raw data, setahu saya bisa minta melalui surat gitu. Cuma nanti coba saya tanya sekali lagi ke ini ya, ke BPS provinsinya. Saya pastikan lagi aja.
Oke, baik, makasih Bu Dita.
Thank you.
Oke. Ada yang lain? Any other comments or question?
Iya, Bu Okta. Kan terkait sebelum kita meminta data, itu kan ada langkah baiknya kita itu mendefinisikan dulu kerangka analisisnya gitu. Apa aja data yang mau dianalisis, kemudian data apa aja yang kita butuhkan nantinya. Kalau tadi kan yang saya presentasikan itu adalah gambaran gitu. Maksudnya idenya, prosesnya itu tahapannya seperti ini gitu. Kita mulai dari menganalisis tujuan yang pengen kita lihat itu apa gitu. Mungkin tadi Koni juga sudah menyebutkan ya pengen melihat ini di fasilitas kesehatan terhadap gender, kemudian demografik segala macam. Nah, dari tujuan itu baru kita mundur ke belakang sampai kita pecahkan itu ke dalam tiap-tiap indikator gitu. Nah, mungkin itu yang perlu dilakukan terlebih dahulu. Nah, kami kan yang orang data ini bukan spesialisasinya gitu bidang di ininya gitu ya. Makanya kenapa ini kita floorkan di meeting supaya ada masukan nih dari teman-teman yang mungkin lebih expert gitu di bidang kesehatan masyarakat atau kesehatan gitu.
I guess next step, if we suggest, Leah, can you share the
File.
the file? Yeah. And
Oh, boleh.
yeah, and Cecily is doing I think her project, it's on looking at what kind of gender sensitive or social equity indicators.
Yeah.
So Leah was asking, because the data team or the dashboard team may be not familiar with the public health or the climate change type of data indicators, like what kind can be included. Maybe we can try to, like, at this point, give some input. What kind of framework inform us for the dashboard development to be more inclusive? I guess that's the research question that we want to answer also. I don't know if that's possible next month. Ibu Italia can also advise us what are, or which group that it's marginalized, like we don't get their data to be included, and how BPS is approaching this. So if there's a group that maybe we don't get their data, they don't come to see a doctor, like those groups, how can we get their data or information? If that's possible, I just curious to know if how can we move towards more inclusive, more justice, because I assume like the data that we have right now are more mainstream people, like the bigger majority populations, but how about those more subpopulation or minority? Do we have aggregated data to separate like who is from where, what kind of ethnicity? Or how can we know that the representative of minority are in our database? So an example, I think some strategy that Australia use also to include the minority, I think they have some certain percentage that they need to have those data in. I don't know if Indonesia have those kind of practices in place. Okta, are you there?
Yes. Yeah, I agree ya. Ya nanti mungkin Bu Dita juga bisa, kalau misalnya ada ya mungkin selama ini mekanisme bagaimana membuat data yang lebih inklusif gitu. Artinya selama ini kan kalau kita tahu pelaporan datanya sifatnya masih general ya. Jadi apakah memungkinkan misalnya ada data yang memang terpilah gitu kan, tidak hanya gender male and female saja, tapi mungkin yang kelompok misalnya kaitannya kelompok disabilitas atau ya yang kelompok-kelompok selama ini termarginalkan gitu. Apakah datanya itu ada data terpilah seperti itu gitu kan?
Yeah.
Nanti bisa di-share juga di bulan depan.
Yeah, thanks, Okta. Yes, the data on disabilities as well.
Okay.
Yep.
So yeah, I think we have a very rich discussion today, and looking forward for next month presentation from Bu Dita. And yeah, I think because initially I just make the Zoom link, and I think we will have like a flyer to disseminate this knowledge sharing, right? So we can send it to our student in, for example, Universitas Mataram or Universitas Syafqala and Universitas Patimura. So Yeah, I have already asked Arifin to prepare the flyer, especially because we already get the speakers for next month knowledge sharing sessions. So hopefully, yeah, we will have a more rich discussions in the next meeting. Terima kasih banyak Bu Dita sudah berkenan hadir dan kami menunggu kesediaan Ibu untuk juga bisa berbagi di pertemuan bulan depan.
Actually, next month is tomorrow, Kak.
Hah?
Next month kan tomorrow.
Oh, yeah, it's at the end of next month, not tomorrow, yeah. So in the 4th weeks of next month, minggu keempat bulan depan, insyaallah. Okay,
So
thank you everyone.
The status meeting, right? Next week.
What, Connie?
Next week will be the status meeting.
Yes.
Okay.
I don't know whether in the project status meeting, because we have very limited number of teams today. I don't know whether Leah could also present, but I think before that, maybe Leah could have a discussion with the more health background, like maybe brewery or Dr. Hendra, to have the idea about this, the data. Okay. Anything else from Connie or from others? Vicky, Cecily? No? If not, could you please open your camera so we can take a group photo? Okay. 1.
Oh, hi,
2.
Zed. Oh, someone behind you. Oh,
Yeah,
Dian.
Dian. Okay, 1, 2, 3. Okay.
Yeah, it's not
Yeah, no?
fair.
Lia is still in the airport.
Oh, okay.
She's waiting for her flight. Okay. Okay, 1, 2, 3. Okay, thank you everyone. Terima kasih semuanya.
Thank
Bye. Assalamualaikum.
Salam.